Now we're going to discuss Nepal and then Pakistan and then Sri Lanka. And to tell us about Nepal, and it's great we're building up this comparative view. We've done your neighbors, we've done India, and we've done Bhutan, is Professor Madhusudan Subedi, who is Professor of Social Science at Patan University in Lalitpur. So over to you.
Thank you. I'll just take a few minutes and I will learn more from other countries. And then if there are some queries and questions, I will share afterwards. For Nepal till today, we have only, I would say, only 45 confirmed cases. Death is 0. We don't have death cases till now. That's why people are somehow optimistic that they will survive. And then recovered cases are 7. The PCR test were 9,011, and then rapid diagnosis tests have been done till today. 31,420, and people in quarantine are 8,595, and in isolation 95 people are there. So today is the 29th day of lockdown here in Nepal. So regarding the government role, the government role has been mostly focusing on quarantine issues, because we have 3 tiers of government: federal government, state government, and local government. So all the governments have been focusing on putting people on quarantine, isolation, and then there has been a huge demand on testing, because initially we were not able to test it, and then there was a very strong demand from different states. We have 7 states. So now rapid diagnosis test has been increased, but people have fear that in rapid diagnosis test, if they get positive, then people feel that they are infected. But once this is tested in RDT, so they get negative, and they are really confused. People are really confused whether our test kits are really reliable or not. So there has been a fear that whether the government's data are really kind of valid or not. That has been a fear from the people's side. Regarding the citizens' response, most of the citizens are staying home, and for the higher class and middle class people, it has been, I mean, they have been managing, because they are getting, they can buy food from the nearby grocery and others. But for the migrant people and for the poor people, the wage worker, this has been very challenging. Though government is providing some kind of food items to them, but that has not been enough. That has been very much challenging these days. And then whether the COVID-19 is serious, or whether poverty and then is a major issue for us. I mean, for those people who are daily wage workers. So though government has been saying that people will not die because of food, but certainly there has been challenge. And government record and then people's daily life and living has been very different one. That has been the important one. And second, because of some cultural issues, there has been a very misunderstanding about social distancing. In West, social distancing and physical distancing is the same one, but in our cultural context, social distancing and physical distancing are cultural, I mean, the different one. So it has been very difficult to kind of to communicate with the people. So that social if in this time, then we have to minimize the, we have to maximize the physical distancing, but we make, the social distancing has been very important, and communication part has been important, but even people don't get recharge card, so that they haven't been able to communicate with the family members who are, some are working in the rural area and some are working in the urban area. That has been a kind of challenge. And then Other challenge has been the people are migrating. I mean, we have a very open border between India and Nepal, and many people are coming from India and Nepal, but we haven't been able, government hasn't been able to manage these people in isolation and quarantine. So that has been a very serious issue. Though government is saying that they have been managing, but in reality, many people are facing problems, and sometimes people are working 10 days, 12 days, which is very challenging without a minimum level of support. Regarding the public health response, some sorts of awareness campaigns and quarantines, isolations has been focused by the different three types of government. And then one of the interesting things that I have found here in Nepal, there are so many NGOs, INGOs here in Nepal. They haven't been able to spend money in this situation. So there has been a key question from civil society organization, because they should have focused it. They should have discussed with their funder, and they should have focused some of their budgets on these crucial situations. But we haven't seen any news from the NGOs on these issues. Other important issue that we have been facing here in Nepal is stigma and discrimination, especially for those people who have migrated from abroad, either from India or even China or others area. Even though they are not infected, then people said, "Oh, he or she has come from India, so she is not allowed to come my home." And so, I mean, maintaining physical distance is one thing, and completely, the stigma and discrimination that has been very bad impression, and then people might be very much frustrated, and then mental health issue has been coming, very crucial issue here in Nepal. And then second one important thing is even the general fever patients, even private hospitals do not take seriously the patients who say that they have been suffering from fever, general fever, not. So that has been the crucial issue regarding the governance, whether the government is able to regulate the private sector or not in this very serious situation. So these are some of the important issues. Though on January 13th, where 32 years old Nepali student at Wuhan University came to Nepal, and then he was admitted in the hospital, and later on he became fine. Then after even 30 days, we didn't have cases. Now, I mean, yesterday we had 42 cases, and today we have a total of 45 cases. So other important thing that people are facing, and there has been a great debate about, the government is entirely focused on epidemiological intervention, contact tracing, testing, but has nothing to say about download and its effect. It's a huge effect. And then lockdown is not the long-term solutions. And then till today, government doesn't have any response. What next? And second, we still do not know the full scale and severity of COVID-19. The full scale and severity of unintended consequences of lockdown interventions are not clear. So what would happen to the daily wage worker? What would happen to the tourism sector? What would happen if we don't get enough? Basically, the people who are suffering from different kinds of diseases, if they don't get medicine, or if they are not admitted in the hospitals. Most of the doctors are saying that if you have this problem, you visit to the, you just ask to the doctors, right? So regarding the South Asia collaboration, yes, of course, it would be good if we could have a good collaboration among South Asian countries. And then basically for Nepal, we have an open border between India and Nepal. So Nepali people are saying that if India is able to control COVID-19, Nepal will be able to control it. If India is not able to control, we will have the same problem.